San Yang, it's nice to have you. I can see Techno come on. I don't know who has the Techno come on air and the Techno Spark.
Yeah, it's Abigail.
It's okay, Abigail, because I like to know everyone that is here. As we progress, I'm going to check and see those people that are joining in with us. So today, basically, we've been talking about, all through the caregiving training, we've been saying self-care for caregivers. We've been saying everything we've been talking about is about the patients, the clients, all through. You have to be passionate, you have to be compassionate, you have to be patient with your clients. You have to ensure that you don't absolutely take their control away from them. You have to exercise power with them and not power over them. So over time, we thank God we have been able to look at a couple of modules from introduction to caregiving, like we started, all through to other topics that we treated in infection control and so on and so forth. So this is very important for us. Today we are almost going to wrap up what we have. So we looked at person-centered care, we looked at communication in caregiving, clients' rights. We are still having the issues. Oh, Jesus. This is not very good. Okay, maybe MJB management, please, because thank you. You've made me a co-host. It's easier for me now that I'm a co-host. I can mute anybody. Thank you so much. We talked about person-centered care. We've talked about infection control, but in this caregiving journey. And I did tell you that caregiving, any health-related training, any health-related training is the practicals that is very, very important. Hence, we are having these practical sessions now. So, without wasting time, let us look at care for caregivers. As caregivers, don't lose guard. Like I always like to make that statement. I always say, don't lose guard. That's to say, in anything you do, in any service you are rendering to your clients or to your patients, do not forget yourself. Do not let go, because sometimes we can have situations whereby because it's need for us to help someone, maybe to take care of our patients, to take care of our clients, we are not conscious of ourselves. So that's why this topic is very, very important for us at this point. We have to ensure that while we take care of them, we also are mindful of ourselves as well. We take care of ourselves. So stress is one particular feature that affects caregivers. Stress is something that it's a natural part of life. Of course, we know in our daily lives, going up and going down, going for work stress, family stress, and so on and so forth, a whole lot of things that we do. So as caregivers, we need to understand the signs and the symptoms of stress so that we can take care of ourselves and avoid burnout and avoid being packed out and avoid the burnout that is attached with caregiving. So self-care takes time. It takes intention and effort. Taking care of yourself takes intention, takes effort. And with practice, caregivers can use some effective techniques to manage their stress and maintain their well-being, which is very, very important. It's a very, very important thing for us to know. Aside the care, like I like to say, aside the care setting, whether you're a caregiver or not, it is very, very important that you take care of your health. Health is number one. They say health is wealth. So don't be so engrossed in the fact that you are working and as such, you have to let go of your health. No, it is important. Like remember when we're talking about infection control and prevention, we did say that you should take care of yourself because it's very easy for you to spread the illness because you deal with vulnerable people. You deal with people that actually need your help. So it is important also that as we are doing these things, moving up and down, taking care of people, being emotionally intertwined with your clients when you see them in the situations that they are, do not lose that of yourself. That is very, very important. Now, self-care, like we already talked about, takes time. So it's something that you put in effort to do. It's not just something that happens. It's something that you put in effort to do and to achieve. So first 1 hour to talk about this last module, and then we have 2 hours to run our practicals for today, the things we need to see and learn. I've had people say, caregiving, and I need to go, caregiving, I'll go, and they'll be treating me anyhow. I'll just go and do anything, just go and be working, doing any kind of work. That's not what I really want for myself. But that's very wrong. That is absolutely wrong for someone to have that idea, because you are actually doing something that is worth the while. All right, now, caregivers can be so busy caring for others, just like I kept giving you an illustration. I can see something in the chat box. I hope they are not saying they are not hearing me. Please, can everyone hear me?
Yes,
I hear you.
Okay, yes. Okay, Mr. Kingsley, please, can you hear me?
I hear you now.
Yes, it's clear now.
Okay, because I just read the chat box now, like I like to do, that you weren't hearing me. Okay, thank you. I pray network favors us today, because yesterday in the CNA, we had network was shaky. So, like I want to say, and not all stress is bad. Sometimes, like, stress is a normal part of everyday life, is a normal part of our lives, stress. Because there's no way you say you stay away from stress. It's a lie, except you just want to be lazy. But if you have a life, you have a social life, you have a spiritual life, you definitely be stressed, or you're a father, a parent, you understand what I'm talking about. So usual amounts of stress keep you alert and motivate you to take action. But when stress becomes too much, when the stress takes a long period of time, it affects your body.
Thank you.
really, really giving you stress. So you can imagine what you would face. You know, things happen. We have been seeing it on Facebook. I've seen a couple of the other time. I was actually going through something on Facebook, and then I saw a person practically spit on the caregiver. I don't know if others got to see, if others saw it, because it was on Facebook. Like the caregiver was trying to see how to handle the dishes, clean and prepare for her, you know, but I saw she was spitting, like the old lady was spitting. She spat on the caregiver. The first time, the caregiver didn't say, she spat again on the second time. Why am I giving you that illustration? I'm not saying you see such people. We don't pray to see them. But the fact is, because you are in the health setting, so mental health should be topmost of top priority. You should be. So too much stress can lead to burnout, like a situation whereby you just feel that you cannot coordinate anymore. I'm just tired. I'm just fed up. I'm just, this is burnout. So, but what you should understand is that you are not alone. Caregivers, we have associations of caregivers. We have groups that you can belong to as a caregiver. Like people I advise that you, when you eventually get that, you join those groups so that you'll be able to rub minds with other people. You get to find out and to know that you are not alone in the business. Like you're not alone. So when you hear other people tell you their own, you will say, that means my own is even better. So it's important that we take care of our health as caregivers. That's that's paramount. Okay, so what are the things that causes the stress? What causes stress? Stressors. Different things can cause stress. As a caregiver, you have your own life. Don't forget that you have your own life. Perhaps you are married, you have your husband, you have your children, you have your own issues as well. So combining it with the way taking care of a vulnerable person, it's very, very, is huge. It's huge. So some things that can actually cause stress, like family issues, like we have here, concern for personal health and maybe illness, concern for health of others, that's your own personal health, and then the health of others. These are things that stress you. Then bullying, like I talked about the lady that the caregiver was spitting on. Bullying, harassment, different things happen. I must tell you, like I like to tell you, different things happen in the caregiving field. But the most important thing is that you have the passion, like I said from the beginning. And secondly, the most important thing is that you understand that these things that happen is not because of it's not just the person's personality to misbehave, if I may to use that word. It's because of the condition that the person is passing through. It's because of what is actually the illness, the underlying illnesses. Because illnesses can make you to behave in a way that you don't even expect. We know that. So it may be if you have dementia, if it's a dementia, a person that has dementia, if it's a person that has maybe schizophrenia or bipolar disorder, these are challenges. So you would not blame that person if the person misbehaves, because the person is acting under that. It's just like someone that takes maybe alcohol, that is drunk. So whatever the person does at that point, afterwards, you cannot hold that person responsible because the person acted under the influence of alcohol. The person that is just, I'm just giving you an illustration so you understand what I'm saying. So several things, you can face bullying, harassment. There are things you would see. I want to prepare your minds because it's not a walk in the park. Like any other profession, there are hazards. There are hazards involved. You understand? So as it is, oh, I'm sorry. I'm checking the WhatsApp group. People are saying some people have network issues. It's so sad. We don't understand why the situation is like this. I don't know. Maybe, well, we are in Nigeria. Oh, thank you. Someone said, I saw that video last year. Good. So you see that sometimes you face difficult people. It's just like in life, aside the caregiving setting, we face some people that are difficult. There are some people that are just difficult. It's not easy to be with them. You understand? Like some mothers-in-law, some fathers-in-law, some people People have different characters. People have different preferences, and you won't blame them because a person's character, to a large extent, is formed based on that person's upbringing, based on that person's experiences, based on the challenges the person has had, based on the thorns and thistles that the person has mounted and crossed. So these are the things that put together shapes a person's life. Maybe a person that has actually gone through heartbreaks, maybe breaking of hearts here and there, maybe vice versa, from the man's side, from the woman's side. Such a person, it will be difficult for that person to trust any relationship, even if the person is genuine. So these are some of the illustrations that, I like to teach. Like I told you, I don't like to train, I like to teach. So when I like to give illustrations to buttress what I'm saying. So you are going to face some of these things. You must not face them, but you may face them depending on whoever you work for or in your line of doing this humanitarian work. Now, death of someone close to you, like I said, can be very, very, I don't know, the stress can be severe. When you have to connect with someone, you have to really link up with someone, work with someone, you know when the person is fine, when the person is not fine, you know the challenges, you sit with the person and talk, you bond with the person and a whole lot of things. At the end of the day, maybe something happens to that person. It will certainly break you. It will break you. So these are things that you have to cushion, you have to guard yourself against. It's like someone preparing for a war. You have to be ready, arm yourself properly. That is why this training is important. So also try to maintain a healthy lifestyle. That's correct too. A healthy lifestyle. Eat good food. Take things that will give you, like we talked about nutrition, take things that will give you value, that have high nutritional value. Food that balance diets that will make you you have to be physically fit for you to be a caregiver. That's another thing. The age is not actually a restriction, but you have to be physically fit because a vulnerable person cannot be taking care of a vulnerable person. These are things that we need to understand. So as caregivers, we have to ensure that we back ourselves all this that we have mentioned too. Issues in the workplace too. Aside your clients, aside the patient, you can have, aside the patients, you can have maybe difficult work environments. You can have a difficult environment that not only the person that you're actually taking care of could
Okay, fine. That's how to eat. That's how it be.
Good evening, everyone. Got me. I can't hear my screen.
I cannot hear anything any longer.
or negative thinking. Compassion fatigue could also be termed as secondary trauma. It's an emotional, physical, and spiritual stress or distress that may result, I beg your pardon, from providing care to others. Like I said, I want to cast your minds back. I think in the earlier when we started, I did give you an illustration. I talked about my father when he was having that issue. And I said that my mother, when we even went to see my mother, it was like we couldn't understand who was actually having the problem, whether it was my father or my mother. Why? Because of the compassion fatigue, because my mother was already weighed down, seeing my daddy every day deteriorate, his condition keep deteriorating. So it wasn't something that was very good. So it took its toll on her. And like I told you, even up till now, she's still bearing the brunt of, she's still receiving the after effect of all those things that happened that time. So compassion fatigue is simply affects someone, places a weight of distress on you when you have been taking care of another person and you are experiencing significant emotional or physical pain and suffering. You see the person that you provide care for passing through a whole lot. Those of us that have had experiences one time or the other to work with people or to render care to people that are actually having one issue or the other, you'd find out that as their conditions deteriorate, it affects you. You feel sad. It weakens you, especially if it is a loved one. So that's just the same thing we are trying to talk about here. So problems in the workplace can equally cause that particular compassion fatigue, like discrimination, like those of us, if you work in a place where we have racism, where racism is actually a challenge, you know how people are treated. Like that video I told you, the caregiver was actually a Black person, and then the patient was a white person. You understand? So you see that disparity, there was already a problem. So she was like looking down. The person that was actually not fine was looking down on the caregiver, or maybe because he's Black, or maybe those racism issues. So these are some of the things that can cause this compassion fatigue. Discrimination at work, harassment, and maybe abusive conduct can create an unsafe and unhealthy environment. That is why, like we started and I emphasized, I told you that in the course of doing this job, if you are eventually, whether you are a professional caregiver or you are an unpaid caregiver, it is important to note that as you do it, derive joy in doing it, find pleasure in doing it, because that's what will keep you going when you come face to face with all these things. And just make up your mind, like I said in the beginning, that if you are not cut out for this profession, forget about the money, forget about maybe for greener pastures. Yes, I know, I understand, but let the passion be your driving factor. Let the fact that you are going to serve humanity be your driving factor, because you may never know certain things like we are talking about. Some environments are unsafe, some are unhealthy and things. So you have to be prepared so that when you come face to face, you're already armed with the techniques that you need. I still insist and repeat that connection is number one thing. When you connect with your patients, you connect with your clients, you build this relationship, it makes your job easier. And of course, who doesn't want to have an avenue where you can just be happy doing your job or make your job easier? So that is practically it. So negative thinking too is something that we have to do away with. They say thinking positive, be positive, think positively. Aside the caregiving sector, in other aspects of our lives, like I said, for you to have this training, there has to be a paradigm shift in your mentality if you are not already like that. Because I know we have very seasoned and distinguished professionals on this platform. So I guess we are already ready for this. But what I'm trying to say is, if you are a negative thinker, it just cannot work. So you have to look at the best. You have to be optimistic in any situation. You have to just keep looking at the brighter side of things as a caregiver. Sometimes I know it can be weighty. You can decide to think, oh, everything is out of control. What can I do now? I'm helpless. I cannot change any situation. All this one I'm even trying to do, it's of no use. This person is already going, or this is already happening. These are some things that I know that will readily come to our minds, or rather, I know that we may be tempted to think. So it is important, or I'm not doing a good job. You may think that, oh, maybe it's not good enough. What I'm doing is not good enough. I cannot do it anymore. All these things are things that can come to your minds. But what I believe is in this life, or what I believe in this caregiving road, is that it is the mind, it is the mindset that you have that really matters. If you have done everything you know how to do best for a person, then you are justified. No matter what results later on, you can be happy. You will still be happy knowing that, oh, I did my utmost best for this person. So it is very, very important that we do away with negative thinking, no matter the situation. So let's see. Let's move to the next slide. Practicing self-care. Practicing self-care. This is very important. Okay, at this point, you know, because of network, I couldn't go through, I couldn't follow the formalities that I used to do. I just want to take a moment to look at the people that are actually here with us today. It's nice to have you. Okay, Mr. Emmanuel, I can see you have joined us. Who is ITS 07? I need to know the people that are with us. Please, who is ITS 07? Who is using that particular?
Collins, Mr. Collins.
Okay, Mr. Collins. Forgive me, I keep forgetting because I know you had told me before. So Juliet, okay, Mr. Kingsley, oh, Kusan, Kusan, it's nice to have you here.
Thank you.
Let's see who are meaning people. Aisha, okay, fine. Omo Jesu, Mr. Michael, Omo Jesu, I have not seen you here with us. I don't know, maybe your network, but however, I just wanted to see the people that are with us. So let's ride on and move. Now, practicing self-care helps us to cope with stress, and it's just similar to maybe filling a car with gas before it is empty. That is just it. When you feel that you have packed out, okay, Mr. Adedayo, it's nice to have you. I've just seen you now, Mr. Adedayo. So like filling your car with gas, of course, you don't wait until your car is totally empty before you attempt to fill it with gas or to fill it with fuel. That is just what it is. So you are gauging yourself. As you are doing this caregiving duty, you are gauging yourself, you are analyzing yourself, you are assessing yourself so that you don't break down. You understand? So when you see that it gets to the limit of you breaking down, you have to do something about it. That is it. That is what self-care means. At any point, you don't feel fine to go to work. You don't feel fine to go to work maybe that day. Take permission, take care of yourself, take your medications, take your vaccinations, ensure that you are well, because of course, you can only be well to be able to handle someone else. So let's look at some of the healthcare self-care practices that a caregiver can actually do. Now let's look at good self-care for caregivers. Recognize and reduce stress in your life. That is it. I tell people that whatever and whatever is going to create any issue for you or is going to stress you, just do away with it. Okay, Mercy, Basi, Anidara, John, beautiful. It's nice to have you. I can see you now. You've joined us. So what am I saying? Anything that will make you feel uncomfortable, anything that will stress you as a caregiver, please just make sure you do away with it. There's nothing that is worth your life. There's nothing that is worth your mental health. That is what I want you to understand. Mental health is also part of caregiving. That's why I recommend and I advise everyone into caregiving field to have a mental health awareness certification, because it will help you to know how to handle yourself and how to handle your clients. When you sense anything, you know exactly the limits you can go. So it's very, very important. Set boundaries for yourselves. Even though we have talked about connection, we've talked about person-centered care, we've talked about preferences, we've talked about a whole lot, it is important that you set boundaries for yourselves. Don't exceed your boundaries. Don't exceed your limit of elasticity. Like the physics, the science people will understand. You have an elastic. When the elastic is actually stretched to the end of it, you know what happens? It cannot return. So don't allow the elastic to stretch to the end of it. Do something about yourself. Recognize and reduce stress in your life. Set boundaries when it has got to do with something you know you cannot do. That's another point I want to highlight here. something that you know that you cannot do, please do not do it. Make sure your supervisor knows. Explain to them the reason why you cannot do it. For safety reasons or for this reason, let them know at all times. When you have to do something that maybe it's not in your service plan, it's not in your care plan, and it goes against your ethics, always ensure that they know, because yourself, you are important to yourself. So now find positive outlets for your emotions. This is another very important thing that we need to understand. Positive outlets for your emotions. There are ways that people contain with their emotions. That's what I want us to understand. And people are different. The way I will take something is not the way maybe Joy Honor that is here in this program. Joy is not the way Joy would take it. Joy may be a temperamental kind of person and I'm not, or I may be a temperamental person and Joy is not. We all have our different ways of going about these things and going about these things. So it's very, very important for us. So look for ways that you can outlet your emotions. When you are angry, take a deep breath. Maybe you are trying to take care of someone, you're trying to attend to your patient, and you are doing everything you can to ensure that you do the best for your patient. But at the end of the day, the patient is not being receptive, like the patient is not giving you joy, if I'm to say that, So at such times, take a break. There's no sin, there's no crime in that. Take a break. You may go outside, depends on how you attend to this thing. You may go outside and decide to take fresh air. You may just maybe breathe in and breathe out, take a deep breath. Do not just react whenever you are angry. So they are positive. Look for everybody. We are all different. We all have our different preferences. So look for the best. So actually, look for the best way that would help you to let go of this emotion, feel maybe emotions of anger or any other thing. Make sure, even in the home front too, it is something that we need to learn how to do, how to let go of our emotions, to outlet. When you are angry, by now we should all, as human beings, maybe as caregivers, people that want to venture into this caregiving field, we should know how best we can contain certain emotions. We should know ourselves well. So you should know that when I'm pushed to the wall or when I'm very angry, this is the only thing that makes me feel better. For instance, maybe a husband and a wife, depending on how it is, people are different. We have the kind of men that when they are angry, maybe they'll just do what they know how to do best, maybe beat up the wife, or vice versa, not only the men. Maybe beat up the wife. There could be another school, a set of another man or set of men that when they are angry, what they do so that they don't do the wrong thing, so that they don't do what they will regret, they quietly leave the house. Maybe if the wife provokes them or something, they just look for a shirt, put it on, and off they go. They go out, and you find out that by the time they just step out and return, they'll feel much better. So why am I using this illustration? It's very important for us to understand and know that as caregivers, we are as human beings too. So we should look for the best ways to be able to contain our emotions too. Also, learn to relax. Relaxation is necessary. Caregiver. The importance of relax. You take time to relax. You take time to have your own life. Know that outside the caregiving, you also have your life. Make healthy nutrition choices. You already about that. Get enough sleep. Sleep is important so that you can stay fit. Do exercises. These are very, very important tips, caregivers. Remember, we are talking about care, self-care for caregivers. Fine, so let's see. Now, we want to look at an assessment. But before we look at this assessment, I would want to, ask, because I'm happy I've seen Madam Kusan here and I've seen others too. I want to ask, from ourselves and maybe from our experiences, can we just maybe share one or two other ways that may not be in my slide that could be a way of letting out emotions, like what you can do maybe when you are sad or when you are happy, some of these things. How else, aside what is on the here, how else can we let out emotions? Okay, thank you, Mr. Okechukwu. Your hand is raised. The floor is open for you Go ahead. Okay,
Hello, good evening, everyone.
evening, Madam Okechukwu.
Yes, so one of the ways to let out emotions, of course, like you said, it's always from individuals and all that. Like they said, some people can do that through crying when they cry and pour out their sometimes when so allow people to cry, it helps a lot to relieve the person's emotions. Sometimes they'll say it's a taboo for a man to cry, all of that,
Someone to
but
cry.
allow them to cry. It helps a lot. And secondly, sometimes some people can just be in a quiet place and you just maybe, although if there are things you love so much, maybe there's some songs you love so much or some things you love so much, you can just go for that. And that can be able to release your stress. Some people might be to read Bible, some people might be to pray, some people might be to just do whatever those things that can enable you to release those stress. But most importantly, like myself, crying helps me a lot. So when I cry, because if you are controlling me, saying not to cry, and if I don't pour out that emotions out, I may not be able to get myself. So people have different ways to manage it. And some people can just keep quiet, they won't talk to anybody, be one alone, and be able to handle it. So yeah, so some men can even go and take alcohol. So we smoke, and some of those ways might be unhealthy ways to manage. Some people go and take alcohol, smoke, but those ones are unhealthy ways. But in a healthy way, like what other ones have said. Yeah. So thank you.
Thank you so much, Madam Okechukwu. That's beautiful. But the fact is, I would really love to see you cry. I love to your video is not on, so I would have wanted to say that you can experiment and let's see how you will actually cry. It's okay, ma'am. Thank you so much for that contribution. It's true. I have someone that used to cry. I have a person very close that will cry. Any little thing, the person will just cry. And it is important that you respect it because we are all different people, personalities, and so we have different ways of expressing how we actually feel emotions. So when you know what to do, when you know yourself, the idea is just know yourself and know what you can do, because certainly you will have situations where you will be tense and you just need to let it go. So you look for the best way to let it go so you can continue to do the work that God has given to you to do to serve humanity. So that's very good. So Madam Aisha, I can see your hand raised. Please tell us if you have something to add to that. Oh, Madam Aisha. Okay.
Hello, ma'am.
Aisha, can we hear? Okay, it's like Aisha is not
Hello,
speaking.
ma'am.
Okay, Madam Kusan. Yes, ma'am. Please. Is that Kusan?
Hello, can you hear me, ma'am?
Yes, I can
This is
hear
Miriam.
you. Okay, Miriam. Okay, Miriam.
Okay.
Fine.
Yes, ma'am. Sometimes if I'm under stress mode or I needed to calm myself down, or I'm in a situation where I needed help.
I can't hear you. I've lost you.
Hello?
Miriam, it's
Hello,
actually,
ma'am.
yes, I can hear you now. Go ahead.
Can you hear me?
Yes, I can. I can.
I look for someone to share.
Okay, I guess network is not friendly from your end, Miriam, because I'm not hearing you. I can see, I don't know, Madam Husan, your hand is raised. Please, can you say something?
Yes.
Say something.
Okay. So just like the two my two colleagues have spoken, there are several ways in which one can relieve stress, especially when you're emotionally down. One of the best things we usually say is that while you're working and you are overwhelmed, maybe by how you are being treated by the person you're giving care to, we say take a deep breath, count backwards, 10, 9, 8, 7, 6. Just take that moment to take it in, breathe out, because breathing exercise is very, very good. There are times whereby maybe after a long period of time where you constantly have such emotional stress, we usually say like kickboxing, where you go and you can let it all out, or you go somewhere and you just shout it all out, just letting everything out. But as they also mentioned, you could, do dancing. There are people that will just go for dancing classes, or some people will just play music, happy music, and you just see them dancing. Yes, we know sometimes like, this person okay. That person is just dancing to, let it out, let that emotion out and everything. Sometimes some people, as they're crying, they don't even want you to say anything. Just give them that hug as they are crying. And then so they let it out. And then once you feel the person is okay, you just say, okay, fine, you're fine. And then you guys just laugh and everything. For me, what resonates well with me is I look for comedy, something, and then listen and laugh. Exactly.
Okay.
Just so I laugh about it. And then, yes, I listen to music. There are very nice songs you can listen to, like classic music. Sometimes for me also, I listen to affirmations, positive affirmations. That's like, I am enough, I am good, I am strong, I'm powerful.
Yeah, I'm not this. Yeah.
So those are some of the things that works for me. Yeah. Thank you.
Wow. Thank you so much, Kusan. Thank you. It's nice to hear those contributions. Yeah. So like I was saying, okay, we still have Mwachuku. Okay, Ugweze, please.
Okay.
Ijoma, go ahead.
Yes. Yeah. Good evening, ma. Like
Good evening.
for me, we have, as a physiotherapist, we face a lot of challenges with patients. Sometimes, even when you are trying to get information from them, they will tell you are stressing them. Do you understand?
Yeah.
They are stressing me. Doctors see them before sending them to us. So when they come to us and we try to get our own information by clerking them, they will tell you that the questions are too much. They ask me questions before they send me and all those things. What I do, immediately the patient starts shouting at my head. What I do is to do as if, ignore that I heard the patient. Because once I have ignored that somebody raked at me now, it helps me to move forward. Because whether I like it or not, I must continue clerking the patient. Because if I don't continue the clerking, I will not get any information from him. And it's from his the information I get, I can treat the patient. Then secondly, after that, you will see that there's a way patients are very funny. Some are aware of what they are doing, some are not aware. They are two different. Some are doing it, they don't know. And all my dementia patients, I know them. Then some intentionally want to stress you out. So what I do is that if I get a negative comment from a patient, seriously, God have given me that strength, I ignore it. And I'm not saying, hey, sir, like what I was saying, I will just blush it out as if I did not hear. And you notice if it's intentional acts, they will continue with you as if they did not say anything. Do you understand? Wow. So don't respond to everything you hear from patients. It will take you to trigger you off. And another thing that saved me, for some of us that have children, I discuss my patient with my kids. I discuss my patient with my relatives. Not that I'll mention the name. I will say, what I saw.
Yeah.
You don't mention the person, but what I saw today in the office is terrible. Sometimes you see that your colleague faced the same thing and had a way of coming out of it in a very good way. When you discuss, you have an idea on how others follow up that same case and made it well. Do you understand? Because you don't have choice. You cannot beat a patient. You cannot rake a patient. Even when you report, they will still tell you to the patient that you are handling a patient. So sometimes you have a loved one. Discuss the patient's case with the loved one. Not that you now say, do you know that Mr. John in number 10? No, there is confidentiality in medical team. But discuss it. Somebody may bring your spirit out of it. Because sometimes patients make me to have BP. I will take BP drug. So it got to a time that I always discuss. When I come back, I call my children and I discuss. And you will see them, they are very small. They say, but mommy, you say it's a patient now. Why not just bear it? Did you see it? So you will hear from your kid. Yes. We discuss patients is good.
Thank you. Thank you so much, Madam Ugweze, for that. You see, you can attest to the fact, I'm happy that we have medical practitioners already on this platform. So you can attest to the fact that it's not easy to handle patients. It's not an easy ball game at all. So you see that sometimes someone can even frustrate you. A patient can even frustrate you in a bid of you even trying to help the person. And the person does not even know that he needs this help that you are even trying to do, but you know the person needs the help. So you see that what we actually need is the patience. What we actually need is the passion. What we actually need is, there is nothing you cannot achieve when you are determined to actually do this job. No matter what you see, you just overlook it because you are ready to do it. So thank you so much for that. I don't know if we have any other contribution, any other question. I guess I've taken everyone's question, but I am finding it difficult because I've seen a couple of people say they cannot join me, and that's rather sad. Juliet, Mr. Dedayo, are you here?
Yes, please, I'm here. Juliet is here.
Yes, I'm here.
Okay, because I'm just going through, you know, I'm a lot. I just have to look at my message and seeing that someone is some people are actually giving one other, which I don't understand. I want everybody to be carried along. So that's fine. So what about Mabel? Mabel, are you here? Mabel. Okay, so there's a problem maybe with her network. She's not able to join us. So let's continue. I just hope she'll be able to sort that out. All right, so let's get to this particular slide, self-assessment. It is important that we as caregivers assess ourselves once in a while. Don't be involved or engrossed, too much engrossed in your work that you don't take time to assess yourself. Check off any behavior. This is a practical assessment. You can just look at it. I take on more than I can realistically do. The ones that you can tick, you tick because you know yourself. So you tick the ones that are that you can tick here. I skip breaks, lunch, or other free time. I don't take vacations even when I need one. It's hard for me to ask for help even when I need it. All these things are things that you need to know that would help you to keep a check on yourself. So if you have checked yes for several statements, then I think you need to consider. Network was disturbing for me. I find someone I can share my worries with and calm me down. Okay, Miriam, thank you for that. You find someone to share your worries with. That's a beautiful one. So as I was saying, you just check it. Thank God you are going to have the slides. You can just tick it out. The ones that you know that are what you do, you tick it out and you will know. So if you have too many yeses, then you should consider starting self-care routine to cope with your stress. You should know that you are getting to burn-out situation, so you should cope with your stress. Fine, so let's see what we have. Tips for making positive behavior. We need to round up in the next 20 minutes so we can move to practicals. So tips for positive behavior changes. Be honest with yourself about your capabilities and goals. We already talked about that. Get help, reward yourself. From time to time, you can take yourself out. I tell people, when you have worked so hard, you can take yourself out, take a break, take yourself out, relax, and be happy. Sit down with loved ones and talk to them, get your life, back. Set boundaries, practice, reward yourself, get help. At any time, I tell people, never you feel bad to get help. I used to tell some of my friends that if I don't know how to do a particular thing, like initially there's one particular dish that was always giving me tough time to cook. Even when I checked on YouTube, I was not able to, but I asked a friend, and she taught me how to prepare that particular meal. And since it's over years now since she taught me, and since that time, even in the middle of the night, you ask me to prepare that meal, I would certainly wake up and do it. Why? Because anything you ask a person to teach you or the help that you get is with you for life. Nobody can take it away from you. Knowledge is the only thing that you would have to take with you eventually when you are leaving this earth. So knowledge is very, very important. Once you are knowledgeable, you are knowledgeable in a particular setting or sector, nobody can take that particular thing away from you. Even if you are robbed of any other thing, you cannot be robbed of that knowledge. That is why knowledge is very, very important. And also, at any point you need help, please get help. Ask for help. There are people around you. Move into the community of caregivers. Seek help. There are many resources. Thank God for technology now. Even if you don't want to talk to someone, you can get on Google, you can search, you can go to anywhere. There are many ways you can get help, seek help for any situation. So Now, we talked about finding positive outlet for your emotions. We've already talked about that, so we are not going to dwell on this slide right now. Get enough sleep and do the normal things that are very, very necessary and important for you to do. All right, so let's see what we have there. Relaxation. This is another important aspect. What are some of those relaxation techniques? Techniques that you need to relax, so that when it gets too hot, you decide to go and cool yourself. Now, what are these techniques? They are simply physical practices that you can use to make a difference, you know, and you can do maybe deep breathing, like one of us said, Madam Kusan, you deep breathe, you breathe in, you breathe out, you do, you dance, go for dance classes, you do a whole lot of things. They are relaxation techniques. It can help you to lower your deep blood pressure. There's one particular one that is an exercise that I want to advise, and that is deep breathing. Deep breathing, very important. When you are stressed, your breathing becomes shallow and rapid. Your blood pressure, you know, gets affected. So if you do this exercise, if you can breathe in, you can breathe out, you can do a whole lot of things. It would help you to relax your muscles. It will help you to slow your heart and respiration rate. It will help you prevent stress. It reduces general anxiety, your energy levels, and a whole lot. It has a very good effect. So we are breathe in and breathe out. Tomorrow, God willing, today we are going to look at the practical aspects of the skills that are needed, some of them. Then tomorrow we'll continue, and like I already said, first aid care for care, skills for caregivers. So we are really going to look at that. That is something too that we have, an exercise that we need to learn. So now, healthy choices that you have to make that will help you to reduce stress. Very important. Sleep better. Make sure you sleep at any point. Make sure you get enough sleep. It is important that you rest. Then increase, because your sleeping helps you. Your sleeping helps you. It helps you a whole lot. Maintain a healthy weight. Don't be overweight. Do exercises to make sure that you remain fevers. You know, some people are a bit skeptical about yoga. They said it has a spiritual implication or so. I don't know about that. But exercises, any exercise rather that you need to do, you have to do it, because it will help improve your bone strength, reduce the risk of falls, and a whole lot of things, because you have to be fit as a caregiver. All right, so now tips for starting or maintaining physical activities. Staying active works best when you do the following. Choose activities that you enjoy. That's very important. Choose what you love. Remember, we are still dancing around passion. This caregiving thing, A to Z, everything deals with passion. Do exercises, do things that are easy to do. Very, very, very important. The things you like to do. You can walk, maybe take 30 minutes walk, move around. You can, you know, these things. Take the stairs instead of the elevator. Sometimes this helps you to keep your blood in circulation, to keep you moving. Do exercises, stretching exercises, and so on and so forth. So value your role as a caregiver. Yes, as I said here, in the course of my trainings over the years, I have had one or two people say, please, ma'am, it's from all the things you have said, it means that a caregiver is automatically a nanny. It's automatically a nanny. And I just laughed. You know why I laughed? Because a caregiver is not a nanny. You understand? And a nanny, whatever profession you find yourself, a nanny is still a good profession. But that person made that comment, and I understand why. Sometimes people tend to maybe look down, not look down per se, but they don't really understand how do I put it? They don't really understand what it can see it as. Maybe you just render and bear. It's important that you value your role wherever you are, even if you find yourself in difficult situations where you have people that are really difficult and challenging. Please value your role as a caregiver. This is very important. If the recognition is not available, if the people you are working don't recognize you, please recognize yourself, because your work is likened to that of the Good Samaritan. Like, if I don't know, we have Muslims, I think there's also the Good Samaritan in the Quran. I don't know about that. But for Christians, you can relate to what I am saying. You are doing something very honorable. Anything that's got to do with you alleviating someone's suffering, you trying to see how best you can help someone. In fact, there is no job that is as honorable as that. So value yourself and recognize your role as a caregiver. So now we want to look at the surviving loss and grief. Wow, this is a part that it used to be sad. It has a little bit emotional, grief. As a caregiver, you will not run away from grief, because of course you are dealing with vulnerable people. One thing or the other, the people could pass on. You could experience loss of a loved one, or maybe someone that you have bonded with, you have worked for, you've taken care of, you've given drugs, you've assisted to use for toileting, you've done a whole lot of things. You've become a part of that person, or the person has become a part of you, the two ways. So all of a sudden, the person goes, or you see the person deteriorating. It's not a nice experience. It's not a nice experience. So as caregivers, it is important that you know that you yourself, you will face grief. You have to grieve. People have different ways of grieving over situations. Your clients too will grieve. So as they are grieving, maybe they've lost a loved one, or they are grieving over certain issues. It is your duty to give them the shoulder to lean on, depending on, don't forget that everything we keep talking about dances around person-centered care, dances around some major principles. So even as someone is grieving, already you know the person. That's one of the understand them. These are things that you should know. So if you understand the person and you know your limit, you know how you can comfort that person in that particular situation, as well as yourself, in this case, both ways, as well as yourself. How you be able to handle the grief, very important. So in such situations, not only death, physical abilities could be lost. It could result in someone grieving. Relationships and social activities, income or financial, so many things, a whole lot of things. So at this particular point, you need to ensure that you give that person all the person needs. You understand? So you have to ensure that you give the person privacy. Sometimes give the person privacy to be alone, because sometimes they may wish to be alone, just like that lady you can see on the picture, maybe just to stay by themselves and ponder, oh, why is this life like this? Or what is actually happening? They need their privacy. So it's important you understand too, as a caregiver, when to be there and when not to be there. Independence as well. Yeah. Self-esteem, a whole lot of things. So grief as a caregiver, it's important for you to be aware of the losses you may experience as a caregiver. So family caregivers, as well as non-related caregivers, can also experience this anticipatory grief, since condition worsen, like I already said, when expecting the person's death. There are some that are having terminal illnesses that they have treated. Maybe they've said you have just 1 month to go, you have just 2 weeks to go, and you know how such things can be weighty on a person, you understand? So a client's grief can also trigger some emotional reactions in you, because you have a connection with this person. Symptoms of grief could be emotional, which is maybe sadness, guilt, fear. These are some of the things as a result of grief. It could be in that particular aspect. So too, we can also look at the mental grief too. Mental health is very, very important. Mental health. So when this person is grieving, it is important that you are there. Mental, maybe forgetfulness, forgetting, mental inability to concentrate. These are some of the things that you would see. Distraction or preoccupation, confusion, loss of perception of time. They can just drift off. They can be depressed. That's why you see mental health awareness is important. They can be depressed. They can just walk into their own world. At such points, you have to be there for them as caregivers. Difficulty making decisions also. Physical grief could be fatigue, they could be tired, lowered immunity, insomnia, they will not be able to sleep, aches and pains. These are so many things. The social as well, withdrawing from others. When people are grieving, they tend to withdraw from others. The social activities, they restrain themselves from being involved in social activities because they are gradually getting depressed, like getting into depression. They are sad about the situation. Lack of interest, they may just lack interest in anything in life. I remember, like, I like to give illustrations. When I lost my father, some years ago, it was something that I've never really had any very close person that I really loved that much that I lost. So when I lost my father, I cannot even imagine how it was. I was withdrawn. I couldn't, because I sat down and I asked myself, what is actually in this life? As in, I just saw the vanity of it all, that is of no use, because he's a man I've always known all my life, very agile, no dull moments, commanding in the military and doing everything. You don't see any dull moments when it has got to him. But I gradually watched him deteriorate. I saw his condition really go worse. I saw a state whereby he could not even do the energy that he had. Everything went, he didn't have it again. And then we eventually lost him. It affected me for a while. That's why I'm trying to say that these things are not very easy to handle. It affected me. I got withdrawn. I even remember telling my husband, I was like, oh, then what's the point of someone walking? I think when you are just born into this world, you just sit down. Maybe in my age, I just sit down, fold my hands and my legs and just wait till any day death comes, I just die. Because you walk all the walk, you eventually die. You don't walk, you will still die. You eat, you will die. If you don't eat, you will die. So all these things, you see, all these things I'm trying to say, all these factors came together and I saw the vanity in life. I drifted up. I refused to attend functions. I was really broken. So, but thank God, because that's why mental awareness is important, and this training, thank God, with the right support I had, gradually, it did not get into depression. It did not degenerate. I just grieved that period. Then I just learned to live with it, because you don't totally forget. You just only learn. So that is practically when we talk about grief. Spiritual too could be feeling caught up or angry at the source of questioning your faith, and all those things. So when you have, as a caregiver, yourself too, you have to checkmate all those things. And even in your clients, in the life of your clients, you have to checkmate it. Now, grieving, someone can grieve for weeks, can grieve for months, or even years. You understand? So emotions and reactions may appear and fade. It is important that as a caregiver at that point, you are able to understand what to do. You too, you are able to be strong for the person that you are handling and understand that they are passing through a tight situation. They are passing through something at that time. So you are there as a caregiver. You have to give them all the support that they need. Be patient with them, understand how they are feeling, and just know that they have different ways of expressing it. That's just primarily what this is talking about. Then grief rituals too. Grief rituals. Some people can decide to go into memory book, maybe planting flowers, writing letters, donating to favorite charity, just to respect the person that has passed on, or maybe just to have memories of the person. They decide to do all this thing, lighting candles and a whole lot of things. These are things that you need to also understand and understand with your clients if you're working with someone that is actually into doing all those things or is actually grieving. Okay, so, and then support for grief and loss. This is very important. They need the support. They need all it takes they need you to give them the support in that grieving process. Very important. Face-to-face support from other people can help you. Seek support from friends. You as the caregiver, if you are grieving, likewise the client, seek support from people. Share how you are feeling and the difficulties you are going through. Express your feelings. Do not bottle them up. Express it, because they say maybe a challenge that is shared is half solved, or a problem shared is half solved. I really believe in that. Find support groups. Belong to other groups where you have other people with like minds to be able to assist you when the need arises. And if need be, consult a therapist or a grief counselor. We have specialists in those areas that could help you to handle your grief and also maybe assist your clients based on your service plan. Remember, you do not overdo things. You work strictly according to your service plan and under the instructions of the care team. You work together with the care team. Okay, now supporting others who are grieving or facing death. I've actually talked for a long time. Okay, thank God we just have 2 more slides. So I need to know if we are listening, if everyone can hear me clearly. I should have asked earlier. Forgive me for asking this late. Are we together?
Yes, I'm listening.
Okay.
Yes, ma'am.
Thank you. Thank you. Thank you. Just 2 people are listening to me. It's so sad. Are we together, please?
No, we're on the same
No,
page
it's
with
actually
you.
Yes, ma, we're together.
Yes, ma'am, we can hear you.
Okay, thank you. Thank you. So let's go
Hearing
ahead.
you,
because
we're hearing you.
I want us to ride on so that we move on to the practical session. So supporting others who are grieving, there are ways you can support others. Some, they just need you to leave them alone. Just leave them, let them be alone. That's a way of supporting, like you can see that picture. Some, like me, I must tell you personally, I don't know how to, sometimes I get confused. Even if I went into the health sector, I get confused how to grieve with someone that is grieving. I don't know if you understand. So because maybe someone says, oh, I lost my father or I lost my mother, I don't know how to, I wouldn't know whether to just go there and say, oh, I'm so sorry for your loss. I heard what happened. Or maybe just to hold the person's hand and, hold the hand tight and just to give the person a little assurance. I don't know if I should go there and sit and cry if the person is trying to cry with the person. So there are different ways that you can support a person that is grieving, depending on who the person is and depending on the setting where we actually are. You understand? But one thing you should understand is there's no better gift that you can give another human being than to be open and present with them during this time. It's very important that when someone, maybe you lose a loved one or the person is maybe having terminal illness or one issue or the other, it is very, very important that there's no other greater gift you can give to that person than for you to be with the person. Let the person know I am with you, I understand how you feel, and so on and so forth. That is very, very important. Sometimes you can decide to find ways to say goodbye. That person may decide to find ways to say goodbye to you and others. Maybe someone that knows that, oh, you just have some days to go, or someone that knows that, it's almost the clock is ticking, I just have to go. And the person may want to give some parting words. The person may want to say some things. So these are things that you need to understand. You need to cushion the effect and swallow it as a trained professional. You need to be able to get a grip of yourself when you come face to face with such situations. It is important that we know that when the person needs to say goodbye to you, to say the goodbyes and so on and so forth. So this is very important for us to know. So we also have, finally, I think this is the last slide before we progress for the practicals. We have the hospice care. We have hospice care. Now, hospice care has got to do with people who have no more than 6 months to live. You understand? Hospice care, they are special people. They are people that you just try to see how to make their days better for them, their last days better. That's why those people, when they know they have these illnesses or this ailment like this, we advise family members to come around. As a caregiver, you encourage family members to come around. You do your best to ensure that you make their last days to be happy. You make them to be happy. You make them to have good memories as they will be passing on. You understand? So this is hospice care is another part. We have specialists. We actually have caregivers that actually specialize in the hospice section department where they take care of those people. So they really have some form of techniques to help them. If it's the one that loves the grandchildren around, like loved ones to be surrounded, you ensure that their last days they spend it very, very happy, at least. And it will make you happy as a caregiver. It will make the family happy. At least they can testify that, oh, at least my mother or my brother or my loved one spends the last days happy. This is very, very important. So if a hospice becomes involved in a client's care, the hospice nurse will have to work with the care team to develop a hospice care plan, as well as the caregiver. There are some things that are normally done. That's another area of specialty altogether. So on this note, I think we have come to the end of all the theoretical aspects of what we actually have. So I would just want to ask if there's any questions. And I'll need to crave your indulgence, please, so that we'll be able to set up. You know, we are dealing with technology, high technology. So I'll just appeal for 5 minutes so that we'll be able to set up our system. So we move into the practicals. We start from the proper hand washing onto the doffing and donning of gloves, and we progress for today. Wherever our time takes us, we'll continue tomorrow with the CPR. So do we have any question, please, or any contribution before we move, before the 5 minutes?
No question, ma'am.
Okay. So are we all together?
My
There's
own is
only
not a
one.
question, but I don't know whether I don't know if it is possible at the end of the sections training, if you can help us, give us a sample of caregiving a CV or resume. I don't know whether it's possible.
Okay, ma'am. For that, I wouldn't tell you a yes or no, because we like to move according to what we say we do. So I wouldn't tell you, because that's actually not part of our own scope, you know, of our own duty to do that. It's not part of what we are expected to do for the participants. But nevertheless, I will get back to you concerning that. Thank you.
Thank you, ma'am.
I'll get back
Thank
to
you.
concerning that. All right.
Thank you.
So please, let's just have 5 minutes, please. Just let's move on to the practicals. Thank you. I'll need to pause.
Okay.
Need to log out and come back.
Please, I need you to help. Please, for this particular session, please, let's mute our mics, because one thing that disrupts picture quality is when the mics are on. Now, microphone, it disrupts the picture quality of what you are going to see. So please help us. If your mic is on, you will not be able to see clearly what is happening. Thank you.
Okay. Now I want to take off the face mask. Simple. And I discard the face mask. Any question as to that? Do you have any question as to the wearing and removing of face mask?
No.
So we should continue.
You can continue from.
Yeah, you can continue, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Now what is this?
Okay, seeing that is one of the for infection control, proper way of wearing, donning, and doffing your PPE. That's very important. So right now we are going to see how we can give a patient bed bath. Sometimes we have a patient that are bed bound. They cannot go to the use the toilet, maybe the bathroom to take their bath. So it's advised that you can clean them on bed making, okay, the bed bath. But before we give the bed bath, we want to see how proper it is, how to make a bed, how to lay a bed making. So let's just watch. At any point you have any question, please ask. This particular section is recorded, which you get to have it afterwards, like I used to do. So let's see the bed making.
Okay.
Thank you.
Like I told you, bed making, hand washing is very, very essential.
Hand washing is very, very essential in every procedure. You start by washing your hands. So I want to be washing my hands again before I proceed on bed making. Okay. Hand washing is very essential. Now I'm going to be making a simple unoccupied bed. Though bed making is a two-nurse procedure, but when there is no nurse, okay, yes. Well, it's a two-person procedure. Then as a caregiver, I am alone today. I am going to be making this bed. So I expect you to watch closely. That's before you proceed on making a bed, any type of bed, you have to have your items together. You have to keep everything that you need for the bed making. For this bed making, I need the bottom sheet. I'm coming. These are my items. You will arrange the linen in order of the way you're going to be using. So first of all, I will need the bottom sheet, and this is my bottom sheet. After I need my draw sheets. This is going to be my draw sheet. Then I am going to make use of the waist sheet, and then the top sheet. Let me change this. This is going to be the top sheet, and this is the pillowcase. So I am ready to make my bed. And first of all, I have finished washing my hands. Can you see me? Hello, can you see?
Yes, ma'am. I can see. I can see clearly.
Yes,
Okay, so I am going to be stripping this bed. Then I put it in the waste bin. Put the pillow away. I want to start making my bed. You make the bed from top to bottom. In whatever you do in bed making, you start from top to bottom. This is the bottom sheet. Can you see me? Ensure that the bed sheet is
Charity,
evenly
please
spread.
off your mute your mic.
Ensure that this bed spread is evenly spread on the bed. Like I said, that bed making requires at least 2 persons working together. They are going between it alone. In case you find yourself alone in a home. Now, here I go. You lift the mattress and then pull in the bed sheet. After doing that, fold this in with your arms facing downward. There must be an envelope corner here. And then you go down, flip the mattress. Okay. Because you are alone, you have to repeat in this direction the same procedure. If you were to have an assistant while you were doing the other side, the assistant would have been doing this other side. The things you don't have, you have to do it. Yes, I am done with the bottom sheet. Now I want to put the brush sheet. Here is what. Have you seen what I have done? Hello?
Yes, ma'am. I've seen it.
I should continue.
Yes, ma'am.
All right. Now I want to put, this is my draw sheet. You give at least 2 photos of the draw
I
sheet.
can't hear her.
Can you hear? Yes. Ask a question. Hello.
Yes, ma'am. I was going to ask, we've seen a lot of times when you're making the bed and all that, shouldn't we be using hand gloves when making the bed, or is it that it's not necessary? Or is it only when the situation arises that we should wear hand gloves when making the bed?
Yes, where situation arise.
Yes.
Okay, thank you.
Bed making does not require the use of glove except in special cases. Hello.
It keeps on going on and off, so I didn't get to hear the response, and I can't really hear too well.
Bed making does not require the use of glove. After washing, you only wash your hands. Your hands are clean and you're working with clean linen. It's not a sterile procedure.
Okay, thank you.
Can I continue?
Hello? Yes.
I want to, it's going to be very sad if we are not actually, the purpose of the defect, if we are not actually taking responsible people. So we don't know, this is technology, so we don't know if you are following what actually happened. So please kindly respond so we can just, as we don't want to facilitate the flow. Thank you so much. And we all see, we understand that particular skill of making the bed.
Yes, yes, I can see from my own end.
Thank you very much.
Okay. So I'm going to be using my draw sheets.
Your mic
And
is mute, ma'am.
Sorry, can you hear me now? Hello?
Yes, I can hear you now.
All right. I'm going to be using the top sheet now. Can you see what I'm doing? You don't have to fill the sheet. Just keep it on the bed and be opening them. Are you with me?
Yes, ma'am.
Okay. Again, start from top to bottom. The fence is done this way. You lift up the mattress, pull in the bed linen.
The video is still. I don't know if it's from my end.
Hello? Hello? Can you hear me?
Yes, ma, we
I
can
can
hear
hear
you.
you, but the video
We
is
can
still
hear you.
from my own end.
Okay, maybe from your end.
Okay. The corner of this bed must have an envelope in. And then you push it. And then you repeat them this way. Are we together?
Yes, ma'am.
Now my bed is made.
The video is off from my hand here.
I want to put a pillow. Can you see me?
Yes, it's going. It's working
Hello?
now.
Can you see me? Oh.
Yes, I can see you, but okay, it's off. Off now.
Okay. Okay. Can you see now? Hello?
Yes, yes, ma'am.
Yes, video is clear, audio is clear.
It's okay. I like that. So this is a simple unoccupied bed. The difference between unoccupied and an occupied bed is that, like you have seen here, this is an empty bed that is ready for admission. But for an occupied bed, it means the patient is already on the bed and that you just need to change linen whereby the patient cannot go out. So you have to manage and change the linen. Do I need to do the occupied bed?
Yes, ma'am.
Bed body, right?
Okay, so far so good. We have learned how to make a bed making. This is how to make an unoccupied bed. So I think we should just see how an occupied bed is actually made. I think that would be better. You know, as caregivers, you can find yourselves in hospitals, in care settings, anywhere.
So it's important you learn everything and that you need to learn. So is it okay? Can we proceed?
Yes.
Yes, ma'am. Yes, ma'am. We can proceed.
Okay, thank you. Go ahead. Go ahead. To occupy the idea
Okay.
as fast as we can. Yeah.
Yeah. All right, I'm going to be making an occupied bed. Mrs. Comfort, how are you? How is today? Mrs. Comfort, I want to change your linen. Okay, I'm going to be making an occupied bed. Like I told you, my client is already on the bed and she is bedridden. She cannot go out of this bed. So, like I told you, start with hand washing. Don't fail to wash your hands. Now I am washing my hands again. Don't fail to wash your hands. It's important. And this is a clean case. You're going to gather your supplies. All my supplies are intact. So this is a clean case. It does not require hand glove. It's a clean case. I'm going to be changing. I told you I want to change your linen. Right. Comfort, please, you come close. I'm stripping the bed. And Mrs. Comfort is on the bed. Like I told you, this is an occupied bed. Comfort. Sorry. Sorry. It's okay. Please ensure that you maintain privacy. Don't expose your patient or your consumer. Now I have removed the lid. So I'm going to be putting another linen for Mrs. Comfort. Sorry, madam. Like I told you, start from top to bottom. Are we together? Can you see me?
Yes, ma'am.
Yes.
Only the men are, sorry, madam. Only the men are actually taking charge.
We are seeing you. We are seeing you.
I don't know if the ladies are allowing the men to take charge. ladies. Thank you.
Okay. Sorry. Sorry. Now, Papa, are you okay? So that's an occupied bed making. Make our patient comfortable.
Okay, thank you so much for that particular demonstration. Thank you. We have seen how to make an occupied bed. Sometimes you have patients that are bedridden that cannot actually stand up, but you know you have to change the beddings. It's one of your duties. So that is just how to do it. So now we are going to remember communication is important as you attend to your clients, continuous communication. So please, is there any question before we proceed to the next part, to turn and position a client in bed?
I have a question.
Okay, please ask.
I have a question. Yes, as at the point of approaching the bed, after I want to change the bed sheet of the occupied bed where the patient is lying, are you supposed to wear your nose mask again, or is not necessary?
It's not necessary. This is a clean case. Like I told you from the beginning, this is a clean case. You only put on those things in maybe in a dating case. This is a clean case.
Okay, so what she's trying to say is a case of, you know, we all have different challenges. So in the case of infectious cases, you need detail to take into consideration, have a need for, it's not infectious, then it is not compulsory to use the hand gloves. I think that is what she's trying to say. So I don't think that's fine. Have you heard us?
Yes, thank you.
Okay. So we really deal with when you are handling as a caregiver, like I said, you must understand the challenge of your clients. You must understand the case. So it depends on if it's just a case of maybe malaria, you know what to do. But if it is an infectious case, of course, you have to make good use of your necessary PPE. So thank you. So let's quickly go because our time is going. Let's look at how to turn and position a client in bed. Thank you.
So I will be turning and positioning my client, and the position will depend on what will be comfortable for my clients. We have the position, the front positioning, and we have the spine position, and then the semi front position. So it all depends on what will be comfortable for my clients. So I'll start by washing my hands. Don't fail to wash your hands. Dry your hands. If this was to be an infectious case, you will put on all the PPEs. In this case, I want to be working with my gloves. Madam Comfort told me that she's having rashes, so I want to put on my gloves. Remember, this is no more a sterile glove. Madam Comfort, how are you? You say you want to relax on the lateral position. Yes, I am coming to assist you. Okay. Lateral position is simply lying by the side. Mrs. Comfort cannot turn herself, so she wants me to assist her lie by her side. Mrs. Comfort, sorry.
Yeah.
Mrs. Comfort wants to lie by her side. You have any other pillow? Okay, so this requires the use of more pillow. So let somebody get me 1 or 2 pillows. Okay.
Thank you.
Thank you. Mrs. Comfort, you take this other side of the leg across. I will be lying by her side as the lateral position. And then you cross the hand, then you pull the patient. And then you place a pillow very close to her. Comfort, are you okay? If I was to have a pillow, there would have been one here. This leg would have been placed on another pillow. That's one. And another pillow here. She would have been resting this hand on another pillow.
So 3 pillows.
Yes, 3 to 4 pillows.
Needed.
Yes, is needed for the lateral positioning of the patient.
Okay.
So my patient is comfortably lying on the lateral position. Mrs. Comfort, are you okay? Okay. So any question as to the lateral positioning of patients?
Please, are we still together?
I'm following.
Yes,
You're
ma'am.
following.
Only Juliet and fine. And I'm wondering where others are.
We are following, ma'am.
Let me see.
We are following, ma'am.
We are here, ma'am. We are here.
Okay, I'm trying to check. Yes, I can see Sylvia Joma. Okay, fine and good. So let's see, because there's nothing as bad as busy doing nothing. Because if you are doing and actually doing it and nobody is with you, then you are busy doing nothing. So thank you for following those of us here.
Yeah, we are following.
Now we want to see how to the last one. I think we don't want us to exceed 8 o'clock. Is let's see how to have to give a patient a bed bath. A bath, very important. Learn skills and know exactly what to do. So thank you. Let's remember that communication is very important. Like we said, like when all along when we've been having the theoretical aspect, I have been telling you that when we get to the practicals, all you need to do is to align it and network issues. So you just align it to understand that at every point, whatever you are doing for your clients, you have to keep communicating, telling your clients what you are doing. I need to raise your leg, I need to turn you that be okay? So that you don't totally take away the control from that person, like we talked about. Person-centered care is very important. So let's quickly delve into that particular skill of giving bed bath. Thank you, Madam.
Sure.
I'm here. Everybody.
No, not
Because-
everybody.
I can see her.
I'm seeing.
I can see with other
Whoever
devices
is turning
inside.
the mic on should mute it back.
That's the thing. When your mic is on, thank you so much, sir. That's the challenge. When they not affect the video quality. I said it from the start. So let's mute our mics, please. Thank you, sir, for that observation. I mean, let's mute our mics. It's better now. Can we see now?
Yes, ma'am. A little bit better.
Okay, please, let's go. Let's
All
go
right.
ahead.
I'm going to be bedbathing my patient. Madam Comfort, how are you? How was the night? I am Nurse Bishop and I'm here to assist you with bedbathing. I'm going to be bedbathing my patients. I'm going to be the activities of daily living. My patients cannot bath themselves, so I am here to do that. And before I do that, I have to gather all the items that bed purchases. My detergent or the soap of our choice is here. I have to gather the powder and the cream. The powder and the cream. The towel. I have the bathing towel, and then the one that I will use to clean her body, and then her clothing. Everything has to be in place before you start the procedure. And then we are going to have, we have hot water already and cold water. So we are going to mix the hot water and the cold water. That's what I'm doing now. Can you see me? Are we together?
Yes, ma'am.
Yes.
All right.
Yes.
So here I have the soapy water and here I have the clean water. I'm going to place them side by side. The wobble. The temperature is okay. Now I'm going to put on my glove. This is bed bathing. So I'm coming. Let me look for my glove. I can't find one side of the glove.
Okay.
You've seen it.
We can see you.
Okay, my supplies are in order. I'm going to put on a surgical glove. It's not a sterile procedure. Together, this is a drug I'm going to then yeah. Can you see me? Are we together?
We are
Yes.
together, but volume is quite low.
Provide privacy as much as you can. And please don't expose your patient. This is all fun. How are you? You take a first towel, fold it around your hand. Use an ordinary water, not soapy water, in treating the patient's eye. In, out. Can you see me? And then you clean this runway in and out, not with soapy water. If the patient can do it, you can give the towel to the patient to clean the waves of the neck. Are we together?
Yes, ma'am.
Yes, but the video is off what you are doing.
And let us get it right. Are we okay now? Hello?
Yes.
Are we okay now? Okay. I'll go over it again. I'm going to be cleaning my patient's eye. But if she is able, she can do this by herself. I'm going to put for her. No, in cleaning the eyes, you don't use soapy water, please. This is soapy water and this is the clean water. So in cleaning the eye, you don't use soapy water, please. You only pick the clean water and then they clean the eyes from in and out. And the left side in and out. And you tap it. Then pick well from soapy water. Remember, please, before you do bed bathing, you have to do assessment. You need to assess the skin in case of rashes or break so that you know how to do it. You do assessment before any bathing. So I'm going to be watching the face and don't be hard on the skin, please. Just on the face, and then you proceed to the neck. Then you drop the towel on the soapy water. Take a clean one from the clean water. Dab the face to the neck. Now for a second. And then you dry the face and the neck. You want to proceed to the chest. Maintain privacy as much as you can. Take the soapy water. I'm on the chest and abdomen now. Expose only the area that you are going to work on. Save clean water. And then you dry that area. Clean water. They do not.
Yes, ma'am, we can see you.
It's all right. And then you clean the leg. And we are done on this side of body. You want to turn the other side Bring up the drop sheet. So this other side of the bed. Soapy water. Clean water. And then you dye. Expose only the part that you want to clean. And what are you okay? Sorry. And then to the left again. And please pay attention to the fingers and the palm. Sorry. That's going to be washing her back. The comfort. I'm going to be washing. Okay. The patient has to be put in a lateral position. Then the draw sheet should be drawn in. Please be very gentle on the back. The comfort. Are you okay? All right. I am done bathing my patient. Now is the private area. And I'll help you wash private area. Hope you do that by yourself. It's all right. My parents say I should not work the private area. But if she allows me to, I can equally do that for her. Now I am done bathing my patient. You need lotion. Powder and lotion depending on the best type of skin. Only on your hand and your face. Okay. Sorry. I'm going to apply this powder on your back. Okay, I am done bathing my patients. I'm going to discard the used water. Okay. And it's assumed I have changed her clothing for today. Take off my towel. I make my patient comfortable. I'm comfortable. Are you okay? You don't have to call me whenever. All right. Have a nice day, ma.
Audio, please.
Hello.
Hello?
Yes, please. Can everyone hear me?
Yes, ma'am.
Can
We
hear you now.
Yes.
Okay. We don't know. Maybe the people can suggest what we can concern this network. Anyone has any suggestion? Of course, I'm always open to suggestions from because I am really finding it not happy, almost affecting my mental health. The network is being the way it is. It's so good. I would wrap it up today. We have a lot to do tomorrow. We have quite a lot to do tomorrow. And our training is by 10 tomorrow. Remember, we still have first aid skills for caregivers. First aid skills for caregivers. So tomorrow we are going to have the CPR, which is very, very important for everyone to be involved. So please ensure that you are available tomorrow. And we want to see want to explore that means whether network will fail, what we can do. But the beautiful things, like I said, we are going to have the recorded versions of everything that we have done. So as we have come to the end of today, I'd like to ask if there's anybody that has actually learned something so that maybe my mental health can be everybody that has actually learned anything today. So if you have learned one or two things, I'd just like you to tell me in one sentence or two. So we call it today because I didn't want us to exceed 8 o'clock. So the floor is open to anyone that wants to say something. Have you learned anything new?
Okay, yes. This is Kingsley speaking.
Okay,
What I learned, the bed bath stuff is not really new to me because I have seen my late mother caregiver do it before. But the thing I can really say I picked from this, or I took away from this lecture today, is bed making. I was never good at making bed, so so I just this one now.
I know.
Yeah.
All right, sir. Thank you so much. We wanted to really be beautiful. There are times in our sessions, it's always beautiful when network those structures, and we've had good reports. I think it's just the period and the weather and everything have been affecting the network. So thank you for that contribution. I guess now you would be able to lay the bed now from what we have learned, you've seen. So any other person, please, that's just Mr. Kingsley. I'd like to speak from a lady, except all the ladies have all gone and left.
Hello, Joy.
Yes, hello. Good evening.
Yes, ma'am. Hello, ma'am.
Yes, good evening. Go ahead, please.
Hello, good evening, ma'am.
Good evening. Good evening.
Yes, concerning the bed making, it's really good to me as well because I haven't seen that kind of method before. And I really want to ask the reason why we use our elbow to measure the temperature of the water. Why not our thumbs or our hand?
Okay, because the elbow is very sensitive. It can detect the temperature of the water.
Thank you so much. You know, if you use your palm, your palm is hard. The skin of your is already used to your palm hard. So normally it's advised that if you want to check water, use your elbow because your elbow is very sensitive. So when you put it there, you'll be able to take the temperature of the water. Sometimes you could equally ask your clients if it's client like silicon to check if that temperature of water is actually okay for him or her. So any of the two ways. I expected that question at a point. I knew someone was going to ask questions. So thank you so much. That. So any other question or any other person has
Yes, I have a
anything to
question.
Yes.
All right. Please tell us your name, the man, the young.
Adedayo.
Okay, Dayo. Network was really disturbing you. I hope you'll be able to
At
see
what
some.
point, love, I'm looking here. At what point is sterile glove? At what situation is sterile glove needed?
Well, the sterile glove needed wherever you have to come in contact with the fluid. At any point, vomiting, blood, urine, saliva,
Yeah.
whenever you have to come in contact with body fluid.
Okay.
Okay, so if you are practically what she's saying is if you have to attend to anybody that has want to come in contact with blood or maybe saliva or someone's to any form of fluid, it's important to use the sterile gloves because it's sterilized for that purpose. So that's why we should use that one. Thank you.
Thank you.
Thank you. We've answered. Yes. Any other question, please?
Hello,
Yes,
mine
I
is
do.
what I learned. I noticed something from the nurse, the medical practitioner. She's
Okay,
always.
can you tell us your name, please?
This is Mrs. Nwachukwu.
Okay, Mrs. Nwachukwu.
Yes, I noticed. In fact, she's in all the things, the procedures she did. She made sure that the patient is being carried along. I noticed in her, she was a good communication factor. She was always communicating with the patient. Even if she wants to move the hand, even if whatever she wants to do with the patient, she will call her attention and find out if she wants her to go on or not.
Thank you. Thank you. That's a bit contribution. Thank you. Thank you so much. You know, we talked about that. Like I said,
yes,
being a caregiver, to work in the park. So you have to make sure you have all your skills in your fingertips. So it's important that you communicate with your clients, with your patients at all times, so that you seek consent, because you cannot do what that person doesn't actually want you to do. That's how it is. It's ethical for you to go ahead. I remember we also talked about power over and power with. So if you are exercising power over, it means you just do the things you feel you should do without the consent of the person. But if it's power with, that means you're working side by side and you are getting informed consent from the person before you actually carry out any task. So this practical is just to buttress what we have learned so far within the theory. Thank you so much, Mrs. Nwachukwu. I don't know on this particular platform. I haven't heard anything from Joy. I don't know if Joy is here. Joy.
I'm here, ma. Yes,
okay,
ma.
Let
me say what I
learned. Now that okay, go ahead, Joy. Yes, I need to hear your voice.
From the practical, hygiene is the most important thing, because if she didn't carry out proper hygiene initially, might end up contacting a disease from the patient or infecting the patient with a new disease.
Wow, thank you so much. And, thank you so much. And your voice is very, very beautiful. I heard you at all in the course of this training. Thank you. So these are practically the things that we have learned. I don't know.
Yes, I have a question,
Susan, okay,
please.
Susan.
Yeah.
Yes, ma'am.
First,
Susan, you question you are asking, you are already part of, you are an instructor. So that you will answer. Go ahead. Go
okay,
ahead.
so I just wanted to find out, like, for some of us, we grew up within the space as retired, learning. We taught how to do the envelope fold bed
making.
Even though they did their own bed making, they did that at the head of the bed instead of the side. But I wanted to find out, we know that these days we have bed sheets that have band at the heads, at the edges, not the sides, I mean at the head and the bottom. And sometimes if you're to do the envelope method to fold, to make the for bed making, how Are there other methods that you can use, not necessarily using the envelope method for, especially when you have those bands? You know, the bands, you just put it under when they put the bed. Is there any, or one can just go ahead and just put the, the bed sheet to the band around the heads, and then that is it? But then really appreciate what she did. Just reminded me of how we see my mom, do the folding of making the bed,
wow.
how you attend to the patient and all that. And then from what one has been doing, how you take care of the patient, you're talking with the patient, ensuring that the patient is okay. Can I move you? Are you fine? Do I stop? What do you want me to do better? Engage, just like you mentioned, doctor. It's patient-centered. Walk the patient through everything you're doing, and things like that. So thank you. That was just the question I wanted to ask. Thank you.
Okay, thank you.
All right, thank you. Bed making can only be practiced using an open bed sheet. You cannot use someone with hand to practice bed making because the envelope concept will not come out with that one. Okay.
Thank you.
So it cannot be. Yeah. Thank you so much, Madam Kusan. And I also want to say that I know you are a legal luminary, but I think you should do more of the, perhaps you want to become a doctor someday or a nurse, because you already have everything it takes to just get there. Thank you so much, Kusan. Mercy.
Thank you, Ma.
Mercy, you wanted to say something, or is it Darabong? You share. You can go ahead and ask your question or make your contribution.
Okay, Ma, please, I want to find out, my network was giving me issues, but I want to find out, did she use soap water on the patient's face? I didn't get that part.
You use soap water on the patient's body and part of the face, but not close to the eye. Are you okay?
That
was cleaning the eyeball and all that. You only clean water. Then you can use soapy water on other parts of the face.
Not the eye.
Not the eye.
Oh, okay. Thank you so much.
Yeah, not the eye. That is, the eye is very sensitive. So even naturally, ordinarily, when as you ask about it, you are very careful with that area, let alone you dealing with a vulnerable person. You have to be careful. So it's just on the face and not really affecting the eye. You just use ordinary water for the eye. So thank you. Do we have any other hand raised? Do you have any other question?
Yes, please.
Okay, please do ask your question. We are free to take any question. Go ahead.
Okay, it's Mercy that is talking. Now you are very beautiful. Thank you.
Oh, this woman, you're so funny. I've been trying to hide my face, and I'm just wondering. I just suddenly realized people have seen my face, and that I've been trying to hide. I just wanted to unveil my face tomorrow for you to see. But thank you for the compliment all the same. Thank you. Do we have any other person to say anything? I'm not actually more just to, I don't know if you're on this platform. More just to Michael, who are here.
There's one other thing she mentioned, not to overexpose your patient.
Yes, privacy, that part of privacy in hammering. Yeah. So you can't expose. Even when you are cleaning, you just take care of the parts that you are working on. It's important that you give your clients that maximum privacy. That's correct. That's very correct. So I think I've touched everybody. I've not omitted. I've not forgotten anybody's name. I don't know if Mabel was there else. Mabel, are you here? Oh, she complained of network. So,
hello, Ma.
Are you there? Yes, please.
Yeah, I was trying to say something.
Is that Mabel?
This is Juliet.
Okay, Juliet. Okay, go ahead.
This class was wow. So the place that caught my attention was when she was trying to dress the bed when the patient was there. So I was just like, let me see how a single person would dress this bed without the help of someone raising the patient up. So that place really
Yeah.
caught my attention and I learned a lot tonight. Thank you.
Thank you. Thank you, Juliet. I'm so glad that despite the network wanted to frustrate us, but we are not frustrated and we keep moving. So thank you so much. I think at this point, we don't have any other question. Anybody that missed out anything, you know, we'll definitely send the video to you as I have been. Tomorrow is yet another day. We are going to start by 10. Please try to hear. We have a lot. We have not actually completed the skill because of time and because network, you know, to be able to set up the instrument and all. But tomorrow, we'll try to do everything, and CPR is very important. So you are going to get to see and all parts of the skills you need to have as caregiver, share how to transfer and so on and so forth. On that note, I want to thank everyone for the patience. Sometimes they go off, sometimes they go on. That's how it is with, you know. So thank you. I want to thank the members of my team, media, my good caregiver, and the nurse, and everyone that has made this day made this day fruitful. So thank you so much, and over to management and integrated services. Thank you.
Doctor, thank you so much. Thank you so much. It has been a wonderful time. You did very, very well. Though network has not been friendly, but we appreciate God so much that we come to the end of today's class. In every situation, there is always, in every negativity, there is positivity. In every negative action, there's a positive action. Even though network tried to make the whole thing negative, but at the end, it was positive. A very, very wonderful presentation. I want to thank our participants. It was wonderful. We are sorry about the network, but we trust that tomorrow will be better. So thank you so much. Thank you, the team of the Dr. Dorothy Kingsley Tugudo, the nurse. You have been wonderful. We from MJB here, we've seen what you did. Everything was wonderful. We appreciate you so much. I want to say a big good night to everybody. Have a lovely night rest. We'll see you again tomorrow. Good night, everyone.
Good night,
Bye.
all. Bye.
Good night.
Good night, everyone.
Good night.
Bye.
Good night, everyone.
Calm down, man.
I hope you can't off my this thing again. Your sister, again, a case study. Lady in a case study.
When person smile with you one time, you don't form mugu for her. That don't they tell you say don't be like that, don't be like that. You don't know say na first way they deal with na weary. And by the way, why would you not carry your own phone when you know the kind of person she is? As immediately this phone run down now, make sure you charge it before tomorrow so that you carry your phone and go. Find somewhere and drop the phone and let it charge so that tomorrow morning it will be fully charged. You carry it and go. How picking and the worry am wey she go carry phone run as she no make you learn.
Oh
I
boy,
understand.
the
If you
lady.
she don't learn with one phone na crime.
That's how we've been learning.
So why did she not carry her own on well? Data na be her problem. She dey feel say
She
she
dey
subscribe.
vex.
Say waiting.
Say she subscribed it and me I won't go